Welcome, welcome, welcome. My name is Elizabeth A. Corshu, and I am the host of Mic'd Up and Unapologetic, where purpose, power, and presence meets the mic. Today, we are going to speak about a very, very important topic. We are going to talk about what your DNA knows and what your doctor doesn't. But most importantly, before I lean into this wonderful discussion and very important discussion, I must share this disclaimer. What we're going to talk about today is we're going to have a very vital conversation about the importance of DNA, genetic testing, and lifestyle and environmental factors. But I must say, I am not a medical doctor, and neither is Ketsia. We are both registered nurses. Ketsia has her doctoral degree in education, but we do have our professional experiences, our certifications, and our plethora and abundance of knowledge from our academic and clinical expertise in order to be able to edify and speak about this subject. So, if there's any concerns that you have medically, I would highly recommend that you follow up with whatever information that we share on this podcast and take it back to your medical doctor. So, first and foremost, I have the distinct honor and pleasure to bring on Dr. Ketsia Alert Sadler. She is a doctor of education, as well as she is my soror of Delta Sigma Theta Sorority Incorporated. And she belongs to a host of other organizations as well, which she'll be able to elaborate in regards to that. But I just want to say that I'm so excited to have Dr. Sadler on tonight. She comes to us with 31 plus years experience in the nursing and healthcare profession. And she is also the founder of the College Café. But I prefer that Dr. Sadler will introduce herself and give us a brevity of her lived experiences and personal experiences. So and professional experiences. I'm going to pass the virtual mic over to Dr. Sadler. Thank you for coming.
Thank you for the invitation, my soror Elizabeth Corshu. I'm very excited to be here this evening talking about DNA and what it knows and what your doctor doesn't. It is very important that we share about that because so often we don't realize that we really do know our bodies and we can trust what our bodies are telling us. You know how you woke up in the morning. By the time the day is going on, something does not feel right. You know something is not right, and you definitely should listen and follow up with a medical professional with whatever complaints you have. So a little bit about me. I am of Haitian descent, came to the US when I was 3 with my parents, who are dearly departed, but everything that I do is a testament to them. Were always public servants, and so it was not unlikely that after I got married and had started having my children, I became a registered nurse. As you said, for 31 years, the last 25 years, I've been an elementary school nurse. And I became a school nurse because I realized, and it's ironic that you have this topic. I became a school nurse because I wanted children to start making lifestyle decisions that they could take into adulthood, keeping in mind their genetics they had inherited from their parents. And so you're talking my language. It's what I've been doing as a school nurse, really every day, having conversations with children about what you eat, what you should do or not do as far as exercising and things like that. And along the way with our oldest and our younger son going into college, ended up founding College Café, which has the mission of providing students and their families with information to make the college and/or trade school of choice affordable. Understanding that the doctor, lawyer, engineer needs a plumber, mechanic, and hairdresser. So I talk to both ends of the spectrum because every career is important. And in the last couple years, and looking at my health as a woman and trying to do things that would strengthen me and focus on my self-care, I've partnered with an OBGYN, Dr. Afria Amerson, and then also two doula womb steam specialists, Alexis Owusu and Sheena Davis, and we formed the Woman Wellness Initiative. And so our mission with that is to provide women with information to incorporate Western medicine and holistic medicine to develop your personal self-care plan that will make you healthy and be able to support your families. So I do a lot. And yes, in addition being a member of Delta Sigma Theta, I am also the education chair for the National Coalition of 100 Black Women, the Bergen Passaic chapter. I'm a charter member of the National Council of Negro Women, the Greater Bergen County section, and also serve on the Department of Health for my town. So lots of hats, but all of them in some way I try to incorporate my love for education and health. So that's me in a nutshell.
Oh, nice. Thank you so much.
You're
So I
welcome.
typically I love to end either begin with a quote or end with a quote, but tonight I'm going to begin with a quote. So food is not just calories. It is information. It talks to your DNA and it tells it what to do. The most powerful tool to change your health, environment, and entire world is your fork. So I just wanted to kind of begin with that quote. And I also wanted to give a snippet behind the scenes. We were talking about how today, January 26, 2026, for me is a rebirth. For me, rebirth day for me. And what I mean by that is that 2020, before we knew that the pandemic was even going to even transpire, I was in the hospital. I went into the hospital uh, on January 26, 2020, not knowing that I had COVID at the time, and I was in the hospital for 21 days. But henceforth, as you mentioned, I believe you shared with your heritage, your parentage heritage. My my mother's heritage is from Haiti, and my father is from Sierra Leone, West Africa. And we'll talk a little bit more about DNA and how our bodies respond to stress and this, that, and the other. Prior to me going into the hospital, January 26, 2020, I was under an enormous amount of stress and I was not eating properly. So, as you know, if you're under a lot of stress and you're not eating properly, it can mutate and it can change. It can basically it can communicate to your DNA and the the biochemical chemistry within to say, hey, something's off here. Let's show up as inflammation. Let's show up as some type of infection, whatever the case may be. So, like I said, very brevity. I went into the hospital and I was in the hospital for 21 days. And a lot of it was because I was under an enormous amount of stress and I was not eating properly. I was not resting properly and all those great things. But I'm going to lean into our first question in regards to the topic today, which is your DNA knows, right? What your doctor doesn't. Okay. So, first question I have for you is in regards to the DNA. Give me a second. I'm sorry. Um, give me a second here. So, tell me tell me how explain to the audience how the DNA tells a story in the best jargon language that people can understand. How does the DNA tell the story of a person?
Okay, so for everyone who is in high school, if you've already taken general biology, we're going back to that, talking about the mitochondria and all those things. But the simplest way is that your DNA is just, it's just like a blueprint. It's telling you, it's saying what color your hair will be, what color your eyes will be, how tall you will be, things like that. But then when we start looking at healthcare, certain things in our DNA kind of predispose us to having certain diagnoses. So that's the simplest way of describing DNA. Didn't want to put people into culture shock thinking about biology in high school again.
Yeah, exactly. We didn't want them to tune off and log off. So
Mhm.
when people hear the word DNA, they often think of ancestry, right? Remember ancestry, DNA, and all those things, or kits or crime shows. How do you define DNA in the context of everyday health and wellness? How do you see that?
Well, as I said before, your DNA is your blueprint, so it's going to be a guide to help you make certain lifestyle decisions about what you eat, how what you should not eat, because we hear, oh, diabetes runs in my family. So, and we've heard the old family say, oh, I got, you got sugar or whatever. You don't want to eat too much sugar. Oh, you got high blood pressure. Don't eat too much salt. And we've been using those words because if you think about it, for those of us who have sickle cell, for instance, I remember my mom saying, oh, you have the trait. So you have to make sure that whoever you marry doesn't also have the trait. So you've kind of already been using it in certain ways, but that's pretty much where how DNA comes in. It tells us what we should or should not do.
Okay, thank you for that. Very interesting. In regards, so the title is basically your DNA knows what your doctor doesn't. So, what does that statement really mean to you? And why might it make some people uncomfortable? Did you ponder about this topic when I sent it to you?
I did. And I think if we attack the second part of the phrase, or of your question, talking about what makes people uncomfortable, is because we put so much faith in our doctors. We
Mm,
figure that they went to school, they know, so why shouldn't I listen to my doctor? But I'll use myself, and a lot of my friends and family know I've been dealing with a particular complaint for the last few months. And you go to the doctors and they may tell you something, and
mm,
they may prescribe something, but it's not helping. But your body, you take the pill, and you realize that it doesn't make me feel right. So just because the doctor says that that's what you need for the complaint, your body is telling you that's not right for you because something in your DNA is not connecting. Whatever chemical is in this medication is not working properly with your makeup. And so that's why we kind of have to trust our bodies to say, if the doctor says take it at night or whatever, if you find that it doesn't make you feel right when you wake up in the morning, then that may not be the right one for you. So you may need to talk to the doctor and have that conversation again as to, yes, you prescribed this, but this is how I feel. So can we try something different? Can we lower the dosage? So that's your body telling you what your doctor doesn't know, because they're just going to prescribe it, not knowing how it's going to interact with you.
very point well taken. I thank you for that. But may I lean in regards to the doctor piece? Um, to those that are watching or currently live and those that will catch the replay, I urge you, I emphasize the importance of your relationship with your doctor. Just like the way Ketsia and I, or myself and my girlfriends, would have a chat and talk, you want to be able to have a really transparent, trusting, respectable relationship with your doctor. Whether it's a male doctor, whether it's a female doctor, whether it's a Caucasian doctor, whether it's African American, Indian, whomever, that doctor must understand and respect and hear what you're saying. And if you feel at for any given time, and granted, doctors are human. Ketsia and I, we're both nurses. We're human. We're all humans. Everybody can have a bad day. But if you're finding that that relationship is strained and they're not listening and they're just prescribing or they're coming with, I usually call it the God factor. They think that they're God and it's their way or the highway. I firmly, and I'm speaking truth to power because I have been in the healthcare. I've been on the receiving end as a patient, and it's a very frustrating factor when you're trying to share your concerns or complaints. So I did have to lean in with that. Um, I'm going to move on to the next question. In regards to traditional medicine, because I did hear correctly, you said that both your parents are from Haiti. Is that
Yes,
correct?
both of them.
So, growing up in whether it's your parents are from the Caribbean, from Africa, from the South, wherever, everyone knows someone that has a traditional medicine recommendation. So, where do you see the biggest gaps when it comes to understanding individual health risks? And this is
Well,
in general across the board.
well, I would say definitely when we look at traditional med, of course, we have, our parents growing up and telling us, oh, if you don't feel well, take this or whatever. But then when you move into going into talking to a physician, when you have a complaint or something, what happens is they tell you what to take, but don't take it the next step further, which I find and I found in my experience that they don't always want to incorporate the food and what we eat. And you mentioned it before. A lot of times, with my experience, I got prescribed, physical therapy and pills. And then with one thing, with finding out that I have a high genetic tendency for high cholesterol, you're waiting to find out, okay, what's the food factor? What can I eat? What can I not eat? So I think those are the barriers that you get information, but then it just stops with the medication. It doesn't go any further to what really should be part of your diet. They'll tell you, oh, don't eat this, but don't eat that. But what does that mean? You know, I have students who are diabetic, for instance, and they'll go to the center and they'll say to them, oh, well, don't eat too many complex carbohydrates. Well, what does that mean specifically? You really have to break it down so that people can understand exactly what it is that they should and should not put into their mouth.
Thank you. Thank you. And I also do want to share too, since I had my experience back in 2020, and it was just like I said, at the tip of the pandemic, and I just saw things from a different lens, I'll say, right, in regards to healthcare. But I did start really following a lot of different podcasts. And one of the podcasts that I really love, and I'm going to share his name. He's a pharmacist actually. His name is Dr. Bobby Price. I don't know if you're familiar with him,
No,
but
never
he
heard of him.
actually talks about how he was very overweight. He did not sleep well, especially when he was working very in the healthcare industry. Now he's just fully holistic and basically talking about the importance of incorporating a holistic diet in addition to taking Western medication. So, why is a one size fits all approach to healthcare especially dangerous, particularly for women and people of color?
Well, it's dangerous because, for one thing, a lot of the medications, when they go through clinical trials, not too many of us are part of these trials. And so the medications or whatever the therapy is may have been tried on someone who does not look like us, who has not lived our experience, who doesn't eat like us. And so we're prescribed them, but they haven't been tried on us. And because we do have that history going back, thinking about the Tuskegee experiment and other places where we were not fairly treated, some of us do are leery of, wanting to participate and things like that. But these days, the trials have so much more um, things in place to protect the individual. But so to go back to your question, it's hard because one size does not fit all. And even if you find a medication to say, okay, we tested, however many number of Black women, we're still not all the same. We come from different parts of the country. One from the country, and if you trace our roots from the Caribbean back to Africa, someone from Benin is different from someone from Senegal. So again, we're not exactly the same. We may be similar. So
Mhm.
that's why you really can't say that, well, this is definitely going to work for you. It might, but there
Mhm.
may be part of us that will not allow whatever medication or whatever therapy it is to actually work. So that's why it can't be. You really have to know the person.
Yes, yes. Thank you. Thank you so much for that. So, what types of health insights can genetic testing reveal before symptoms ever show up?
Like we've been saying, lifestyle, how you eat, your diet, maybe even where you live. Do you need to live in a place where there's more sunshine, less sunshine? There are things that if we knew, like for me, I'll share, like finding out that my genetic tendency for cholesterol was high. Maybe I would have been eating certain things differently. Maybe my mom would have cooked certain things differently for me. But
Mhm.
again, going back 10, 20, 30 years, certain tests were not available to us. But um, but definitely the thing is that we have to do is ensure that we're able to eat and do what's right for you as a person. And then, like I said, and going back with that also is sharing with your kids. So once I found out that information for myself, I told my sons who are 30 and 34, soon as you can, to talk to your doctors to find out what your numbers are. So you can start making changes in your 30s as opposed to in your late 50s, as I did. And, as I said, becoming a school nurse, and I've always said it to people as well, when we talk about healthy lifestyles as kids, you
Mhm.
want to prolong the inevitable. For instance, if we'll look at your genetics and say that, okay, diabetes is part of your genetics, okay, what can you do as a young child to ensure that you're not being diagnosed in your 20s? What can you do to prolong the fact that, okay, when our bodies start breaking down when we're adults at 50 or 60, it may happen, but what can you do to prolong that actually happening? So that's the importance of knowing your genetics, at an earlier age, if
And
possible.
yeah, no, no, I agree with you. But I also, you say prolong. I I also want to say, if a person goes and gets genetic testing and learns earlier than later, they can actually reverse some of these genetic predispositions. You know, yeah, yeah. I just wanted to just share that piece, if because lifestyle, environment, food, like you said, there are certain things that can be prolonged. Maybe you won't see it well into your what 70s, or maybe not. But um, yeah, it's definitely one to think about. So when you talk about DNA testing, can you help explain to some people that, like, for example, that struggle with weight despite doing everything right, or they don't respond to medications well, or they still are experiencing chronic fatigue, inflammation, or anxiety? Can DNA testing help explain why some people have, they may not have all three of the components, but may have a few or all?
Well, no, definitely. Knowing exactly what you are made up of will help to determine what will work and what won't work for you. And like we're saying now in 2026, the testing is available, not for everything, but for some things. So, if possible, why not find out what it is that's keeping me from being able to lose weight? Or why isn't my body responding to certain medications? So, if it's available, then definitely a person should do it, because yes, weight loss, I think, is one of the biggest challenges that a lot of us have, that you get to a point and you're like, okay, I've changed my diet, I'm exercising, I'm drinking water, and yet I still am not losing the weight. Well, there are genetic reasons why. There are some diagnoses or genetic makeup where those hormones that control our hunger and our satiation, some of us don't have as much of them in our body, so that's why. So if you don't have that inner control mechanism, it doesn't matter what you're doing on the outside. It's not going to work until you figure out how to fix, if possible, what's going on inside.
Can you just expound? I know what the word satiation means, but can you expound on someone who may not understand what satiation
Oh,
means?
being satisfied. So pretty much our bodies have different hormones, where one will tell you when you're hungry, it's time to eat. And then there's another one when you are eating to a certain point, your body will say, okay, I'm full. But for some of us, that's not working in us. And so you may continue to eat, not realizing that you're full. So regardless, so you have to know, wait, that's probably what's going on with me. And that's why I'm not either stopping to eat, or I don't realize that I am hungry and need to eat.
Yes, yes. So why do many doctors do not include genetic testing in routine care? Do you have an idea as to why, or should I skip this question and move on to the next?
I don't know, but I'm thinking it's probably because, like I said, for me, if it wasn't until I made a specific comment to one physician who said that, oh, maybe we'll do this test. So until it may be an age, it may be age discrimination. The fact that if you go to a doctor at a younger age, they may not think to do it, or you might have to have a specific complaint for them to say, oh, yes, let's do it. I don't know if it's part routine. I'll say back, if I think back to my last 5 physicals, no, that hasn't been a question. Let's do any type of genetic testing. So is it not part of what the doctors are asking when they're doing your routine intake, or when they're doing your physical? Maybe that's not the blood work that they're asking, that they're putting in.
And so what inspired you to do it?
Well, like I said, I was having a complaint in my body, and especially this particular test with my cholesterol, with the pain. My husband said, "Oh, why don't you go see a cardiologist?" I'm like, "I'm pretty sure it's not my heart, but you listen to the husband who's trying to help you feel better." So I did, and then talking about my family history, the doctor said, "Oh, let's do this test on you." And I said, "Okay." And so
Was
we
that
did,
the
and
cardiologist? Was that
when
the
I went to
cardiologist?
the cardiologist, yes, he mentioned,
So,
like
so,
talking about
so
my
that,
parents.
oh wow, that's
Mhm.
that's wonderful. So that was
Right,
your cardiologist that recommended that.
right.
Mhm.
Hmm.
Okay, that's
So
good.
again, if you go and you're always healthy, it may not, but when you think about it, so that's why it's so important, like I said before, for parents to talk about their health history with their children, because you don't want your kids to end up having to deal with something. Like, I've heard so many stories of families, of parents who have cancer or something, and they don't want the kids to know.
Mm.
They'll be going for treatments, and the children do not know until the parent passes away. And it's so important. Like in my family, our father had a bout with colon cancer. And it was only because for a couple days he was just vomiting, not feeling well, went to the doctor, and then in doing testing, they found that he had a mass on his colon. So he had surgery, it was removed, the tissue was biopsied, and they found that thankfully it had not spread anywhere. So they had pretty much contained the cancer 85% through surgery. So he didn't need any type of uh, radiation or chemotherapy afterwards for the colon cancer. But that still meant that we as children now, instead of getting a colonoscopy every 10 years, we have to go every 5 years because of that family history. Now, if my dad had gone to the hospital by himself and never told us, we wouldn't know. Thankfully, those of us who've done the colonoscopy so far, they've been clear, but you never know. So those conversations are so important.
Yes, yes. True, true. It's very, very important. So, wow. Thank you for sharing that piece, being vulnerable. I really do appreciate that and
Mm.
sharing that with the audience. So, I'm going to lean in to the final question, but I do have some other like rapid questions I'm going to ask at the end. So, as a founder focused on women's wellness, what genetic blind spots disproportionately impact women in regards to like testing hormones, fertility, autoimmune conditions, heart health? Maybe just pick one or two, whichever is more, you're more passionate. I know you're very passionate about heart health, and maybe pick one of the others.
Well, I would say if we want to talk about heart health, and we've heard it before, when women complain about not feeling well, those are sometimes our symptom of a heart attack, as opposed to men who will have the left-sided neck pain, jaw pain, things like that. And so that's why I support the American Heart Association so much in their research in helping women to understand when you don't feel well, you need to get to an emergency room because you could be having a cardiac event. So if I had to focus on that, and as a founder with the women's health, it's again advocating for yourself and saying, no, I do not feel well, this is not me on a normal basis. I'm usually the type who can get up, run around, do stuff with my kids all day, but today I am tired and I just don't feel well. So it's a matter of advocating and having somebody come along with you when you don't feel well to your appointment, so that they can listen as well, but also be supportive to say to the doctor, look, I know Ketsia. She's usually, an Energizer bunny, but today something is not right with her. We need to do the EKG, or we need to do whatever it is needs to be done to figure out what's going on with her. So that's the piece, is we have to be able to advocate for ourselves.
Absolutely. Absolutely. Kitsia covered it all in regards to that piece. I, I can't, all I will say to that last part where she said that you have to follow up. Um, I don't want to take away from this wonderful broadcast, but I will lean in and share a tidbit because I'll talk more about it in Women's Heart Month. I too experienced a heart event, and that heart event would come at my third trimester of pregnancy with my twin sons. So, like I told you, Ketsia, a couple of nights ago, if I did not speak up and say to my kid's father at the time that, um, I won't be here anymore, any longer. Um, that's how I ended up. That's how I ended up in the hospital, and that's how, thank God, I spoke up. So I am about to. I don't want to take up too much of your time, but I do like to. Give me a second. I do like to end with rapid fire questions. So, would you like to participate?
Sure.
Okay, great. Oh, ooh,
Mhm.
technology,
It's great.
technology. Yes. So I believe I was asking you about DNA or lifestyle. Which one is more important?
Whew. Mm, I guess DNA, if you know it.
Okay. And give me one second. Good. Okay. Are you able to hear me? I just want to
Yes.
make sure
Hmm.
because I know that it basically dropped a while ago. Okay, so one health myth genetics completely debunks. What health myth do you think genetics debunks?
Mm, I guess thinking that you can't overcome certain things. Like just because diabetes runs in your family, meaning that you cannot overcome it. So, if
Yeah,
that makes sense.
that's a good one. Most overlooked genetic risk in women. What's the most overlooked genetic risk in women?
Ooh, I would have to go with cardiac again.
Biggest mistake people make about being healthy.
Hmm. Thinking that even just a little bit of a bad thing is okay.
Okay, that's a good one. Something your DNA can reveal that surprises people the most.
Ooh, that's a tough one. Hmm. I would guess probably thinking that you can't overcome things. Just knowing, like I said, I'm gonna use the diabetes again. Thinking that, well, I know my family's got diabetes, and I'm never gonna be able to overcome it just because we have diabetes.
Is genetic testing prevention or power?
More power knowing that you can prevent certain things. But I think it's the power of knowing that, having that knowledge to be able to make the decisions.
Mhm. Yeah, because I feel like without that power, there's a level of vulnerability, there's a level of fear, there's a level of doubt. So
Mhm.
when you activate um, that power, you're a force to be reckoned with. So yeah, I
Absolutely.
would definitely say that. So one word doctors don't say enough.
Nutrition.
I want to say one. You can beat this.
Okay.
Hmm. And I'm gonna share a reason why I say that. Um, in 2015, when my father was diagnosed with multiple, my late father was diagnosed with multiple myeloma, I prayed. I'm a faith warrior. I prayed. I went straight to creating spinach and acidic, just creating an acidic environment where he was drinking all types of green leafy juices and vegetables. But the most beautiful thing to hear my father come back and say that the oncology doctor said, he said, and I wrote it in the book, Beyond the Vision. He said, Elizabeth, I was so scared. But he said, that doctor said to me 5 words: you can beat, 4 words, you can beat this. And when a doctor speaks life, there's power
Hmm.
in your words.
Absolutely.
And when a person speaks and edifies, it's almost like the scripture, um, I can do all things through Christ who strengthens me. So when a doctor says you can beat this, that's a chef's kiss.
Hmm. Absolutely.
So
Absolutely.
I think more doctors, I hope some of them are watching right now, but more doctors would really be beneficial of saying that. Medication or modification first?
Modification. Absolutely.
Nature or nurture? Who really wins?
Hmm. That's a tough one, but I'm gonna go with the nurture part.
Yeah,
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 I'm gonna go with nurture.
yeah. One symptom people normalize that they shouldn't.
Symptom. Ooh. I'm gonna go with pain. I'm going to say pain because I think sometimes we end up learning how to live with pain. Speaking for myself, because if it's not debilitating you and not interfering with your activities of daily living and your work, you end up thinking, okay, I guess this is how it's going to be.
Hmm. Um, I would say one other thing. This is to anybody, whether family, somebody, whoever might be going through something, a diagnosis right now. A diagnosis is given, right? And then there's a treatment plan. I tell people do not let a diagnosis define you. And I'm speaking truth to power. I shared with you, Ketsia, when the cardiologist walked into my ICU room 1 week after I gave birth to twins and told me my heart compatibility pumping factor of my heart was 5%. 5% not compatible to life. So I didn't own that diagnosis of heart
Mhm.
failure. Hmm. So I tell people don't let a diagnosis define you.
Absolutely not.
So I'm going to thank you so much for participating in this wonderful broadcast, this
Thank you
podcast.
for inviting me.
And before we close out, I just would like for you to share with our guests if there's any upcoming events. I know you're always doing wonderful retreats, your workshops, workbooks, whatever, speaking engagements. Is there anything that you would like to invite the audience to?
Nothing at the moment. If there's any parents out there who are looking for support with their children with the college financial planning process or any parts of it, definitely you can reach out via on Instagram, College Cafe _. Um, I'm on LinkedIn as well, my full name if you need to reach me there. And as far as the women wellness, we are in the mode of preparing for this year's programming. So you can find us on Instagram, woman, WOM apostrophe B, not excuse me, WOM parentheses B, close parenthesis, EN wellness. On Facebook, and you can follow our page to see what will be happening. Our retreat is definitely October 24th, 2026, so save the date for that. But until then, we are working on it to make it an impactful time of rest and rejuvenation for all the ladies who come out and join us.
Awesome,
For
awesome.
now, thank you.
Thank you. So I'm going to close the podcast with this final quote. It says, "Your body hears everything your mind says," by Naomi Judd. Thank you. Thank you so much, Kitsia. I hope
You're
you have
welcome. Thanks for
one,
having me. Me
and
too.
I wish you all the best for this coming 2026 year. Take
All
care.
the best to you. Take
Thank
care.
you. God bless.